today we're going to be talking about all things bra related. But before we get into that topic, can you tell us a little bit about yourself and what it is that you do?
I started the bra consultancy about 6 years ago now. We're in our 7th year. And I went to work for 3 plastic surgeons and reconstruction surgeons and felt there was a need for ladies going for surgery not having the right garment.
What do you think the consequences are if you wear an ill-fitting bra?
We've seen a big rise in the shop of ladies complaining of breast pain, going to their GPs, going to their breast surgeons, going to their local hospitals, having scans, where in fact they're wearing ill-fitting bras which are actually too small for the cup and not encapsulating the breast. So there's been a significant increase. And also with COVID, a lot of ladies are, like we all were, wearing gym clothes because we were all at home, and at that time they're wearing very loose garments, so it's not actually supporting the bust around the torso at all. You're dead right, Tasha, that ladies do buy garments thinking, I'll get it off the peg, that will do, but they wouldn't put their feet in badly fitting shoes, but they will put their breast in a badly fitting bra. So part of it every day is education for the lady to say, you're better off having 3 good bras than 30 cheap bras which are actually going to give you breast pain.
So, this conversation already explains, or illustrates rather, the difficulty in getting a correct bra size, and that's without having had breast surgery. Now, obviously, if you've had breast surgery, then getting a good fitting supportive bra can also be, probably trickier and more difficult and more challenging. And it doesn't really matter what kind of breast surgery you have, because I think that does have an impact on how you get a bra fitting, whether that's breast conservation surgery like a lumpectomy, whether you had a simple mastectomy, so you've gone flat, or if you've had a mastectomy and reconstruction. And, depending on the surgery type, you'll probably have different challenges, depending on what surgery you have. So let's talk about, and we'll probably, talk about these, or should talk about these in turn. If you say had a simple mastectomy, so, you've had a mastectomy and you've gone flat, so without a reconstruction, how do you help these women gain symmetry in the bra, because that's obviously the aim of a bra fitting, and presumably you use a prosthesis to help them. How do you do that, and how do you provide the best supportive bras for them?
So following surgery, once they've been signed off by the surgeon that they're happy for them to go into the bras, it's normally unlikely they can go into a wire bra for at least a year, and their body will tell them when they're ready for that. With the mastectomy, they're normally given by the hospital a prosthesis. So they would come into store and we would offer a private consultation with them. And because it's quite an emotional thing, and it's quite it's a very personal thing, we like to give a really personal service. So listen to the lady, ask her what she likes, whether it's a t-shirt bra. So we do sell bras which are pocketed, so the prosthesis can sit into the pocket of the bra. And then we will make sure the prosthesis, we normally do this first of all with a soft bra, so we can actually make sure that the prosthesis they've been given actually matches the natural side, rather than put them in a moulded and it can hide sometimes. So if we put them in like a really soft t-shirt bra, we can actually see that the prosthesis is matching the natural side. Then we know exactly it's the same projection, it's the same depth underneath, and then we can choose different styles for them, whatever their personal choice is. The good thing about the pocketed bra is the prosthesis actually sits in its own pocket within the bra. So if the lady was bending down to pick up shopping or picking up a small child, she knows that that prosthesis isn't going to come out of the bra. So you will need a full cut bra as opposed to a plunge.
How do you correct asymmetry like that, because the asymmetry can be quite you know, not that great. Do you know what I mean? It's not a huge amount. It's not, you know, not necessarily, I mean, it can be maybe half a cup size, but usually it's quite subtle. But there is still slight asymmetry in the bra. So how do you correct that? Is that difficult to do?
Yeah, so if it's like an implant reconstruction where there is a slight imbalance, um, there's little tricks we can use. One being, it's better if it isn't a rigid bra, i.e. molded bra, because if a lady's had an implant reconstruction, you're trying to put something quite rigid into something quite rigid. So that
Hmm.
doesn't bode well. So you're better off with the lady with some elasticity to the garment. So if it's like a stretchy lace, that's going to lay better and hide the imbalance. Sometimes we do little bra cookies, which are like an oval piece of material, which just lifts the breast up. You just pop them under your breast, and it just lifts the
Right.
breast tissue up to even up on the
Okay.
chest. Um, but normally it's the right garment, either a cookie, the stretchy lace top. Um, one of them normally works because, like you say, it's only a small imbalance. In a bra,
Yeah.
you could see it. You'll see it more in a molded bra because of the
Right. Yeah. Of course.
it's a
There'll be
rigid
that gap,
garment.
won't there? Yeah. Okay. So there are kind of tips and tricks that can be used to kind of negate that. So that's really useful. And I think, you know, uh, somebody's asked me this question. You know, is there a correct way of wearing a bra, putting on a bra?
um,
Is there a correct way of wearing it, or putting
yeah,
one on?
most of my day is spent teaching ladies how to put on bras.
Right. See, who knew, right? So, okay, explain to us what the best way of putting a bra on is.
so,
How should you do it correctly?
so when we're in a fitting behind a lady, we actually work behind them. So that way we're not staring. It's quite an intimate environment. And what we do, we hand them the bra. So they'll put their arms through the bra
Right.
and ask them to lean forward. Now, making them lean forward actually makes them the breast pendulous, and by the
Yes.
breast being pendulous it comes away from the chest wall. So then when you put the bra on, you sort of scoop and sweep the bra underneath the breast, and then nothing gets caught between the breast, the casing of the bra casing and the wire. You fasten it at the back, and then you adjust the shoulder straps, the sliders. So there's about an inch. I'm old school, so I'm not sure what it is in centimetres, but about an inch on the straps. And then normally your left side is your more dominant side because of your heart. So the slider needs to be slightly lower than the other one. Not a lot,
Right.
just sort of half a finger's width. Um,
Okay.
and just make sure that the shoulders have got that inch lift and that the weight is being put around the torso. So when you pull the bra band, you should have like 2 inches from your spine. So you've got, and we always fit to the first hook. So there's more longevity as the garment gets worn. There's more longevity to go in and move it to the middle hook, to the tightest hook. A lot of ladies can't actually put their arms behind their back and do the bra up like the first
Hmm.
way. So that's fine by doing it up at the front if you do small turns. It's when the lady does big tugs of the bra, it actually pulls the garment out of shape. So if you do small turns around your body till you've got the cups in front of you, and then again, if you put your arms in the garment and lean forward just to make you, and wiggle into the garment, give yourself a little shake so you know nothing's getting caught underneath the breast. There's no breast tissue hanging out below the garment cups, and
Okay.
your breasts are in the bra nicely.